Is brought to you by Tufts Health Plan. No one does more to keep you healthy.
All right, Kim, thank you. Shifting gears a bit this morning, it's an up-and-coming career that has many adults back in the classroom through an innovative program right here in Massachusetts and in Boston. Students are becoming certified as whole health educators. Now, what is a whole health educator? We're about to find out. Dr. Georgiann is the executive director and founder of the New England School of Whole Health Education, and Rosemary Dewey is also joining us this morning. Is a graduate. Ladies, thank you first for joining us. And Dr. Donadio, we'll start with you. What exactly is whole health education? Explain it to us in simplest terms as possible.
Well, health education is very straightforward. It's educating people about the cause and effect of their health or their disease. This year in April, the Institute of Medicine actually put out a study, and the Institute of Health put out a study saying that 90 million Americans are health illiterate, meaning that even though we're highly educated and very sophisticated people, we don't understand the most basic health information that we're given by our doctors and by our practitioners. Our model of health education was developed over 30 years here in Boston with 2 hospitals, many doctors and nurses and health educators to bring about a model of relationship-centered, one-on-one health education that allows the patient or the client to be the center of their healing and the center of their health care. So whole health education is the whole person health education in a way that they can control that and they can understand that.
So what does your school help a student do? What is your goal? Someone comes in, you teach them about whole health education. When they leave, they are going to be able to do what?
Well, we have programs for nurses. We have programs for medical assistants, for social workers, doctors, complementary alternative practitioners. We have programs for just about every kind of practitioner in the health field, as well as people who want to become health educators who are not in the medical field. So we have physicians who take the program, nurses, people like Rosemary, who was a school teacher and wanted to go into health education. So we can serve just about anybody who wants to be able to deliver to people a hands-on sense of control over their own health.
And you, as you mentioned, Mary, you used to be a teacher. Exactly what made you want to change fields and get into this and learn more about it?
Well, my own family's needs. I have 2 children that were health challenged. And as a preschool teacher, I noticed that what children had in their lunch boxes for snacks and for lunch was highly processed. And I've made that direct connection between how they felt and what they were eating, what their mood was like, what their behavior was like. And at that moment, it was an aha moment, I realized that I needed to do something about this and to share it with other people. It wasn't just my children anymore.
And I know you've combined your background in education and teaching with the Raising Healthier Children program that you're involved with. Tell us a little bit more about that.
Yes. I believe that that for optimal health we need the best fuel, the best food, and a healthy environment. So I educate my clients to nourish themselves and to have whole foods and also to have a non-toxic environment.
And Dr. Donadio, what are some of the benefits that the patients are receiving? So folks you educate, they go out, and then the people they're dealing with, those people, what benefits are you finding that they're getting?
Well, the comments, I think, speak for themselves, and Rosemary has a wonderful story if you want her to tell it. But the benefits are very simple. It's my life, it's my health. Nobody is going to be more invested in me than myself. So why not give me the tools? Why not empower me with evidence-based, integrated information so that I can discern what I want to do and how I want to do it to take care of myself? Rosemary, you have a great story. Would you mind sharing that about one of your clients?
The 22-month-old,
yes.
22-month-old diagnosed in Boston Hospital, in a Boston hospital, with colitis, and the little fellow. The mother had no idea. They had never bothered to do any food allergy testing. I suggested to her to take him off wheat and dairy because he just would kill for an extra whole wheat bun. And it was so simple. 5 days later, she calls me crying that the child had his first bowel movement, you know, a regular stool. So it was exciting to see you can help family and change your life.
It's good to know you can have that positive impact.
Absolutely.
You're doing some wonderful work. We appreciate you both coming in and joining us this morning. For more information about the New England School of Whole Health Education, you log on to the Whole Health Education website, wholehealtheducation.org. You see it there at the bottom of your screen. Ladies, thank you very much.
Thank you.
Appreciate it.